Welcome to Arirang Live. It's after 2 p.m. here in Seoul, and I'm Kim Dami. In just a minute, we're going to cross over to the latest briefing from the Central Disease Control Headquarters on the COVID-19 outbreak. Earlier in the morning, South Korea confirmed 323 new COVID-19 cases, reporting more than 300 cases for 2 days in a row. 308 of them are local transmissions, mostly from the Seoul metropolitan area. But almost 70 cases have originated sporadically in 13 cities and provinces across the country. And with 5 more new deaths, the death toll is now at 321. Following the rapid virus spread starting Sunday, social distancing here in the country will be much stricter. Lasting for 8 days, the new measures are a stronger version of the current distancing level 2, affecting the greater Seoul area. The country's health minister Bang Neung-hoo said on Saturday that raising the social distancing level to 3 will be inevitable if the country fails to bring down the number of COVID-19 cases. The briefing is getting delayed, but once again, earlier in the morning, South Korea confirmed 320 new COVID-19 cases, and that's reporting more than 300 cases for 2 days in a row. The briefing has just begun, so let's take a listen.
First of all, here is Deputy Director Kwon Junuk with explanation. Let us begin our regular briefing on the COVID-19 response here in South Korea for August 29th, Saturday. As of midnight today, we have a total of 308 new local infections and 15 new imported cases. The total caseload now stands at 19,400. 214 more people have been discharged following full recovery, while a total of 4,314 people are in quarantine undergoing treatment. There are 64 patients with severe or critical conditions. Yesterday, we had 5 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the latest on our domestic infections by cluster. As of noon, these are the latest statistics as of noon, so please understand that they are subject to change. And related to Sarangjeil Church in Seongbu-gu District, Seoul City, we have 40 additional cases were confirmed from contact investigation, and a total of 1,018 cases have been confirmed to date. In relation to this church, as for the cases with a further transmission stemming from the church have amounted to 25 venues, amounting to a total of 154 people, 9 more religious facilities, and they were followed by 6 nursing hospitals and 6 office spaces. And related to August 15th Seoul rally, we have 13 additional cases being confirmed to date, and in total, 307 have been confirmed to date. And on the August 15th, related to the Seoul rally, we have seen further transmissions of nth transmissions, and a total of 6 venues have been confirmed. And a total of 62 people have been confirmed as nth transmissions above that of the secondary transmissions. And all of these 6 venues are religious facilities. Also in Seoul, the Muhan Group in Gwanak-gu District, we have 6 additional cases being confirmed from contact investigation. A total of 72 cases have been confirmed to date. And related to an apartment complex in Gurogu District and a livestock company in Gimcheon-gu District, we have 1 additional case. A total of 34 cases have been confirmed to date. And related to the Light Church in Nohwang-gu District, Seoul City, we have 3 additional cases being confirmed today. And in total, we have 20 cases being confirmed to date. And in Gyeonggi-do Province in Namyangju, in relation to a Chamsarang Nursing Hospital, we had the first index case on the 21st of August. And we have confirmed that a total of 17 cases have been confirmed. And in total, cumulative cases of 18 have been confirmed to date. As of now, we will go over the patients with severe or critical conditions and the death toll. The accumulated death toll is now 321, and about 97% of them had chronic illnesses, and also the fatality rate was the highest at around 21% for those over the age of 40. Today we have a total of 64 patients with severe or critical conditions, and a majority of them, 84%, are over the age of 60, and they amount to 54. And as of now, we have confirmed that 39 of them have chronic illnesses. And next, we have updates on our R&D. As for remdesivir, it has been administered to a total of 155 patients here in South Korea. In relation to plasma development, a total of 1,420 people have expressed intentions to donate their blood plasma samples, and a total of 1,040 people have also completed their donations. And we extend our deepest appreciation for all of those who have expressed such intentions and who have donated your blood samples for our R&D. And we also would like to thank the Daegu City as well as the Korean Red Cross for your cooperation. And as for the convalences, plasma treatment, they have also been administered to a number of patients here in Korea. And today we have 15 new imported cases, and 5 were from the USA, and 3 from India, 2 from Bangladesh, and 2 other from the Philippines. And during the morning briefing, we explained that starting from tomorrow until the 6th of September, for the next 8 days, we will have toughened measures here in the metropolitan area on top of our level 2 social distancing measures. So we ask for the residents in the Seoul metropolitan area to abide by these quarantine measures, and they also are subject to a target of intensified measures targeting many facilities like restaurants, cafes, bakeries, and also indoor sports centers. In particular, we would like to note the high-risk group, especially those who are the senior aged. We ask you to also take particular caution. And as for all of the metropolitan areas, nursing hospitals and nursing homes, and the senior citizens welfare facilities will be closed, and visitors will be also prevented from visiting the nursing hospitals and nursing homes. And also at door-to-door sales facilities, as for the illegal group gatherings, we will also have an call center that will also crack down into these information sessions going forward that are held illegally. And in order to curb the further spread of the virus, the KCDC continues to ask the members of the public to abide by quarantine measures, and we ask you to abide by such stringent measures as well. And during the weekend, please abide by the quarantine measures going forward. And when you are making essential visits, and aside from these essential visits like going to health clinics or going to get necessities and going to work, please refrain from having your gatherings and social gatherings and outings. And even if you are going outside, please wear your face mask properly. You need to cover your nose and mouth completely, and you shall never and not touch the surface of the face mask. So please remember that this is a very important guidance. And last but not least, we have a few words before we close our briefing. After the COVID-19, the world has changed to a greater extent, and now we have to adapt ourselves to these changes. And if we fail to highlight the importance of quarantine, it is very difficult, or sometimes it is actually impossible for us to maintain our daily routines. And globally, we have seen some of the countries that have been highlighting the importance of economic development over quarantine, and thus have eased their lockdowns and quarantine measures. They are also going through another resurgence of the COVID-19 outbreak. And we believe that the COVID-19 is something that that is not only posing a challenge here in South Korea. However, we see that in Europe, many countries are facing another resurgence of a wider outbreak, and we believe that we can minimize further isolation and lockdown with our quarantine measures. Now, stemming from the Sarangjeol Church and the Seoul rally, it has been about 2 weeks since we have first had the index cases, and also it has been 14 days since we have elevated our social distancing to level 2 in the metropolitan area, and we have now learned that the social distancing measures like distancing and wearing face masks are very important, and it is about time that we will have some outstanding outcomes and results stemming from our social distancing measures. And on the surface, we see a very challenging situation right now. The virus is spreading at a fast pace, and it is also spreading to a wide range of area. And we have also unidentified sources of infections. And moreover, we also have some cases where elderly people have died, and after their death, they have been confirmed with the COVID-19. And also we have the GH strain that is also spreading throughout the country with high rates of infection. And it is also a big concern for us that many of our public are very tired of the social distancing measures. However, nevertheless, we need to understand that the only effective solution that we have at hand is carrying out these quarantine measures. And starting from tomorrow, we will also be under mandatory tougher quarantine measures. But this is the only solution we have at hand right now. Even at this very moment, there are many people, managers, users, students, and the managers of religious facilities that are operating the high-risk facilities. And so far, they have also complied with the quarantine measures, and they have also preserved and also showed endurance. And we would like to thank all of you taking this opportunity, and we will also like to apologize for such toughened measures as well going forward. And as we explained today, there are also many people who have been overcoming the COVID-19 and also donating their blood samples. And moreover, in the Shincheonji case that has been a major outbreak in the country from February to March, many of the worshippers have also donated their blood plasma samples, and also we also had great support from the Korean Red Cross as well as the Daegu metropolitan city as well. So likewise, we see that our society is showing a great level of endurance and understanding and forgiveness, as well as unity and solidarity in front of our battle against COVID-19. I have a strong confidence that such sensation will continue going forward. And so once again, we urge the members of the public to stay home as much as possible during this weekend, and please wash your hands on a regular basis, and also keep your masks on and keep a healthy distance between others. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다.
There you have it. We'll bring you more details on the briefing in our upcoming newscast at 6 p.m. Korea time. Until then, goodbye.
The COVID-19 outbreak is emphasizing the importance of wearing a mask, as the virus is transmitted mainly through respiratory droplets. For your own safety and that of everyone around you, wearing a mask is not an option but mandatory. Before wearing a mask, wash your hands thoroughly with soap under running water. Cover your mouth and nose completely and seal the mask tightly over your face. Avoid exposing your nose, wearing it below the chin, or touching the surface. What we need now is a joint effort to stop the spread of the virus.